Super excited to be here today, and I just want to give a shout out to Dr. Michael Cole. This is his brainchild, as well as many of the experts that are joining us today that are international, national experts in medical education as well as human trafficking. None of us have disclosures. I just want to make sure that we say that out front. Our goal is to give you tools today to be able to teach about human trafficking on your busy emergency medicine shifts. So the purpose of this very brief didactic is to just go over what trafficking is, the scope of the problem, how it relates to emergency medicine, and then I'm going to hand it over to Dr. Cole to give us some instructions, and then we'll dive right into the exercises. So we're here in the United States. I'm going to share the definition of human trafficking as defined in the US. So at its core, human trafficking is the exploitation of an individual for someone else's profit. And the way the US law lays it out is actually in terms of the actions of the trafficker. So the trafficker recruits, harbors, transports, provides, obtains, via force, fraud, or coercion, an individual for sex or labor. So the two main kinds of trafficking are sex trafficking and labor trafficking. And a very important caveat here is that under the age of 18, anyone that's engaged in commercial sex is considered to be trafficked by US law. So what is commercial sex? Commercial sex is exchange of anything for value for sex. So that could be food, that could be shelter, that could be a ride. So again, under the age of 18, there doesn't have to be that force, fraud, or coercion component. And traffickers use a myriad of methods for that force, fraud, or coercion piece. So they use physical and sexual violence. They do bait and switch scams, debt bondage, and use other forms of psychological coercion and threats. So the scope of the problem. So statistics for trafficking are really difficult. This is a clandestine problem, it's a criminal activity, and the field is constantly evolving. This estimate is from a 2016 estimate based on the International Labor Organization's multi-year process in collaboration with Walk Free. So it's estimated in 2016 that there were 40 million individuals that were enslaved in modern slavery. US statistics are even more difficult. So this is a heat map from Polaris, who runs the National Human Trafficking Hotline. So here you may want to just try to pick out your city or your state here. Again, realizing that these are calls to the National Human Trafficking Hotline and don't necessarily represent prevalence. So why does it matter to us as emergency physicians? We have here on the top, have you seen a trafficked patient? Because they may have seen you. This is something you may have heard in the phrase, hiding in plain sight. And for those of you that are in the room that have started to learn about trafficking and have started to identify this in your emergency department, it's one of those things that once you start looking for it, you're definitely going to start finding it. So the statistics that we share here are US-based statistics. They're from convenience samples, but based on these studies that are in the US, 68 to 88% of trafficked persons access health care while exploited, and greater than 50% of trafficked persons were seen by an emergency clinician. So that's why it matters to us. And we're on the front lines of identifying so many vulnerable populations, so it's not surprising that we're identifying this population. So again, our goals today are to give you tools for that bedsiding on busy emergency medicine shift to be able to teach about human trafficking. And again, the caveat around the statistics is that they are limited based on largely convenient samples. I'm going to hand it over to Dr. Cole to get us started.